can go back.
Yeah. Okay.
I'm starting off saying that part of what we'll do in this webinar today is just go through some slides and a lot of tips that we give a lot of our clients who we see in the home those first few weeks and months home. So we're going to go through some slides, give you some tips that way, and then we're going to do more of a live demonstration. So I will leave it to Emily to start introduction.
Welcome, everyone, and I'm so thrilled that you're here with us today. You can hear us, and thank you so much for joining in. Again, my name is Emily Silver. I'm one of the co-founders of Boston Naps. I'm a family nurse practitioner as well as a lactation specialist, and this is my business partner, co-founder Jamie O'Day, who's a registered nurse and also a lactation specialist. So today we are here with our fabulous partners at Cozykin, and we are going to talk to you about baby basics. So our top tips for when you bring home your newborn. So whether or not you're pregnant and expecting a baby or you're listening in today with a newborn, we are going to go through some of our kind of like tricks and things that can hopefully help them out.
So we just wanted to start off with introducing ourselves. Again, this is Emily. I'm Jamie. We met about, I think we just decided about 10 years ago when we were working together as labor and delivery nurses at Beth Israel in Boston. And while we were working there, we sort of started to notice a pattern where families were looking for support when they went home from the hospital after having a baby. And we sort of thought, you know, why not? Why can't we be the people who are providing these families with support? It was, you know, clearly a passion of ours, working in labor and delivery. And we'd love to be able to educate parents from pregnancy through those first few weeks and months home. So we started Boston Naps 7 years ago, and now 7 years later, Emily and I have 2 daughters of our own. I have a 3-year-old and a 1.5-year-old, and Emily has a soon-to-be 3-year-old.
Yep, almost 3 and just 1-year-old.
Yep, just turned 1-year-old. And so our families have sort of grown along with our business, and that's honestly sort of been one of our biggest assets. And you know, one of the things that we can bring to the table for you as families, either welcoming a baby into your life for the first time, or if you're home with a baby right now, is that, you know, we're not just nurses and lactation specialists, but we're also moms just like you. And so a lot of the advice that we like to give families when they go home is medical advice and real life advice, because we get both aspects of that. So now our company offers prenatal education, daytime and overnight nursing care, lactation support. As Emily mentioned, we're both lactation specialists. And everyone on our team at a minimum is a registered nurse. So you get a healthcare professional who's very experienced working with pregnant moms, postpartum moms, babies, families who've just had a baby. And that was important to us for a lot of reasons, but mostly because we know that some of the advice as soon as you get pregnant or when you go home from the hospital can be sometimes conflicting, sometimes from friends, family members, healthcare professionals. And so we really just wanted to be able to provide you with the best and most up-to-date, you know, research and practices that we could recommend to you from our team. So that was really important to us. And then the other piece of that too was also just to sort of be able to provide our families with the extension to the care that you were receiving in the hospital when you had your baby. So for those of you who are home with babies right now, I'm sure there was that one nurse or many nurses who you met and you were like, can I please take you home with me? And so we really actually wanted that to be able to happen for our families. So it really is an extension to the care that you're receiving in the hospital. So that level of care is really important to us as well. And then in addition to that, we really are just, again, because we're moms like you, we know how important a sense of community can be. So what we're also doing through Boston Naps is creating a sense of community where you can have us come in, or you can come to, you know, one of our classes or workshops and meet other moms who are going through exactly what you're going through. And so providing you a safe space to be able to ask questions, get feedback, and meet other people who really understand what you're going through is really important to us as healthcare professionals, but also as moms as well. So it's just to sort of dive into the topic for today. We're going to talk about baby basics in the 4th trimester. I'm going to pass it over to Emily just to talk about those first few weeks home and sort of what you can expect. And we'll break down the 4th trimester into 2 sections, 0 to 6 weeks and then 6 to 12 weeks, and how you can sort of troubleshoot different issues during that time.
Yeah, and so I think when we built the content today and thought about what would really be helpful for people listening in, I tried to, with Jamie, think about what are the biggest questions that we get in our visits in our first few days home from the hospital. And I think the best place to get started when you bring home a newborn is to really learn and understand the fourth trimester, which I'm sure some of you have like heard about, or we've referred to this newborn stage as the fourth trimester. And where it actually comes from is Dr. Harvey Karp, who is a pediatrician who started the Happiest Baby on the Block. And so at Boston Naps, that is a huge piece of our education to our parents, is utilizing his education from his books and his teachings. And so he really drives home the point of the fourth trimester. And so that is your first 3 months home from the hospital. And so what does that look like? Babies, when they're born, they would probably have voted to stay in a little bit longer. So if you ask a baby, hey, do you want to stay in there for one more trimester? They would definitely say yes. And as moms who have been pregnant and out there who've been pregnant, we would definitely vote no. And why would they want that? So inside your womb when you're pregnant, they're used to like this tight, confined space. They're nice and snug. It is very turbulent. So we'll talk a little bit about white noise. It's not actually dark inside the womb. There are some lights in there as well, but it's a lot of movement. So if you can imagine when you're pregnant all day long, you're probably working, you're out moving around, and as you're walking and doing things, you're creating even more turbulence, which is soothing your baby to sleep, in addition to the loud noises inside the womb, which sound more like a vacuum cleaner or like a hair dryer inside. And so they're really used to this like feeling of comfort, tight, snugness. And so to understand how to best respond to our babies in the first 3 months home, Dr. Harvey Karp really studied something called the calming reflex. So if I saw a patient in a doctor's office, I could tap their knee and I could get a knee jerk reflex reaction. And so in fact, he discovered that babies have a calming reflex and how to trigger them. And so, a reflex rather. So later on, we're going to talk about the 5 S's and how to trigger a baby's calming reflex. And part of that is they have an immature nervous system. So a baby, all newborns have a startle reflex. What is a startle reflex? So you may have your baby fall asleep nice and comfy on your chest, and then you put them down and they're asleep in their bassinet. If there is a loud noise or like a door slamming, they may startle, or they may do it for no reason at all because of their immature nervous system. And so what happens is they actually kind of like throw their arms and their legs out and jump, and it really scares them. And so then they end up crying, and so they wake themselves up. So part of triggering this calming reflex is going to be not only when you put them down, when you're not holding them anymore, is kind of mimicking now the womb, which will be getting them nice and tight, giving them that sense of comfort, giving them the movement, the white noise. And so we're going to build on that as we go. I think the most important thing that Jamie and I want you to take away if you are expecting a baby, you're sitting at home right now with your newborn, is really in the first 6 weeks, your only job, or let's call it the fourth trimester, honestly, which is beyond 6 weeks, your only job right now is to feed your baby and not let your baby get overtired. So I'm going to turn it back to Jamie to kind of break this down even further.
Yeah, so I wanted to first start with talking about those first 0 to 6 weeks. And I like to refer to the first 0 to 6 weeks as pure survival mode. For, again, moms who are tuning in who have a baby at home during this time, or who maybe who just got out of this phase, you know what I'm talking about. I'm not trying to scare those moms who are pregnant, but it is a little bit of survival mode. You're really just trying to get your baby to eat, get their weight up, get as much sleep for your baby and yourself as you can. So it is a little bit of survival mode. So one of the major things that I talk to a lot of our clients about during those first 6 weeks home is not worrying and stressing too much about a schedule, which can be hard because a lot of people are going back to work at 8 weeks, at 12 weeks. And so to not think about a schedule, I do completely understand, can be really hard. But we will talk a little bit more about when to incorporate a schedule and how that looks. So sort of setting your expectations for those first 6 weeks really to just be survival mode. You're feeding your baby. You're trying to get your baby to sleep. You're trying to get sleep. You're trying to feed yourself. Emily and I joke all the time because the 3 things that you choose between as a new mom every day is eating, sleeping, and showering. I mean, admittedly, my husband would laugh at this. Showering always came last every time. And so I really had to figure out how to incorporate that in every few days. But really, you're in a little bit of the survival mode.
So eat in the shower.
Yes, that's what one of our employees, suggested the other day. So really, we, setting that expectation of you're just trying to, feed your baby, get your baby's weight up, and start picking up on their cues, because it's a little bit of a getting to know each other period too. But that doesn't mean I'm not going to leave you with any, without any strategies to be able to help during those first 6 weeks. So one of the major things that I talk to clients about during those first 6 weeks is the one thing you can do is start to get into a rhythm of developing and getting your baby used to days and nights. How do you do that? The first and sometimes easiest way to do that is really just getting more calories into your baby during daytime hours. And so that means more feeds during daytime hours. This will eventually, hopefully sooner rather than later, but eventually result in longer stretches of sleep at night. So how do you feed your baby more during the day? My best suggestion for people is to first start with setting your daytime hours as a little bit longer. So you're not going to do 2 12-hour blocks. You're probably going to do more of like a 16-hour block and then an 8-hour block. So let's use 7 a.m. to 11 p.m. as an example. So these are going to be your daytime hours. During those daytime hours, I want you to feed your baby every 2 to 3 hours, or at least every 3 hours. Meaning that if your baby is sleeping at the 3-hour mark from the last time they fed, and feedings, you start the clock for feeding at the start of a feeding. So whatever time the baby starts eating is when you start the clock in terms of timing feedings. So if it's been 3 hours since the last time that your baby ate, that is a scenario where I would actually tell you to wake your baby and feed them. The reason being is that if you get a baby who sleeps beyond 3 hours during the day, they're typically going to make up for those lost hours without eating at another time. And when does that usually happen? In the middle of the night. So one strategy that you can start implementing now, or as soon as you get home, is really trying to encourage your baby to have more of those feedings during daytime hours. So really keeping an eye on the clock and trying to feed your baby, not just on demand, but really keeping an eye on not letting them go much longer than 3 hours without eating. Then at night. So typically the recommendation is, now based on the schedule that I'm giving you, 7 a.m. to 11 p.m. So then your nighttime hours would be 11 p.m. to 7 a.m. Typically the recommendation for most pediatricians, and be sure to ask them this, is the marker that they're looking for babies' weight gain is by 2 weeks of age, they want babies to regain their birth weight. Meaning that breastfed babies lose weight initially, because there's a period of time between when you deliver your baby and your breast milk comes in. So babies naturally lose weight, and that's okay as long as it doesn't drop below a certain percentage. But then the goal is that your milk comes in, your baby starts eating better, and they start to regain their birth weight. We expect babies to regain their birth weight by 2 weeks of age. So that's the goal. That doesn't always happen, and it's okay if it doesn't, but that's usually the goal. At which point your pediatrician can tell you, or we as lactation specialists do recommend that you don't actually have to wake your baby at night to feed them anymore. So what that means is if your baby's eating well, they've regained their birth weight. Now during nighttime hours, you can actually let your baby sleep for as long as they want. So again, our nighttime hours now being 11 p.m. to 7 a.m. That might be that your baby still wakes up every 2 to 3 hours overnight. That might be that every once in a while or consistently they give you a 4 or 5 hour stretch, and that's okay. So the idea is that daytime hours, they're having a little bit more wakeful periods because they're eating more frequently. Nighttime hours, we're establishing, a routine at night where, they're going to sleep and they're just up and eating and they're going right back to sleep. And really allowing babies to start waking up on their own and feeding on demand overnight. So those are the two things that I really talk to families about during those first 6 weeks home is establishing days and nights, setting yourself up for babies getting used to getting in the majority of their calories in during the day, because eventually they will be, believe it or not, they will be sleeping through the night. So they will be getting all of their calories in during daytime hours. So that is something that you can establish very early on. And that really is what we focus on during those visits that Emily and I do during those first few weeks in the home. Do you want to talk about feeding? Since that's sort of important in the first 6 weeks.
So I think that it'd be nice to establish how you know when your baby's actually hungry or not. And a lot of this will be troubleshooting, and we'll talk a little bit more about troubleshooting. But as Jamie said, if we're really looking to feed the baby every 2 to 3 hours all day long, most newborns will wake up to eat or give you some form of hunger cues. Okay, we'll talk about the ones who don't, but the ones who do will often start with early cues. And so kind of pay attention to your baby during daytime hours. At night you'll be sleeping, but you'll notice that your baby will start kind of smacking their lips, licking their lips. They start opening their mouth and kind of making little mouthing motions. They also start sucking on anything. So they start putting their fingers in their mouth. They start to put anything around them in their mouth. So if they're on your shoulder, they might start to try to suck on your jacket. If anybody's holding them, they might start trying to sucking on their shirt. And so then they become a little bit more active. So they're like, hey, I'm here, I'm hungry, I need you to pay attention. You've missed these early cues, and now I'm going to get more active. And they actually start rooting. And so, for lack of a better way to explain it, I'll just kind of show you. And they actually look like a little kind of like monkey, and they're like, oh, like swinging their head back and forth with their mouth open. And you'll see that they swing their head like this, side to side, and they're actually looking for your breast. And they'll start positioning themselves. So they actually start throwing themselves, and they become very fidgety and very squirmy. And they're like, hello, why are you still not recognizing that I'm ready to eat? Older babies will often start kind of hitting moms on the arm, and then they start fussing because they're getting frustrated. And so typically if you see these early cues or that they're becoming a little bit more active, we would want you to pick your baby up and feed them. Late cues, meaning, they've showed some of these things, or perhaps they haven't, and they've really just truly gone from 0 to 180 on you, but they become very frantic. And so a lot of moms, when I see them for a lactation visit, will say, I put my baby to the breast and they're telling me I don't want it. And they get to the breast and they're moving their head frantically side to side. So it looks like they're saying no, but they're actually just frustrated, and it's a late hunger sign. So you have to calm them down and then feed them. Or babies are just crying. And so for our babies who naturally wake up every 1, 2, 3 hours and you're feeding them on demand all day long, you're going to look at them and you're going to say, okay, they're starting to smack their lips around, they're starting to root or look for things. Those babies, I want you to just pick them up and put them right to breast. And so even a diaper change along the way from an earlier active cue, and then you do a diaper change and go to the breast, can actually disrupt the feed or make the baby get a little bit too frustrated. So I want you to just feed that baby. Now we're sitting here telling you get all those calories in all day long. What do you do if you fed your baby at noon and now 3 o'clock's rolling around and your baby's still asleep? We actually want you to get them up for the feed because we're telling you to get all these calories in so they can regain their birth weight and that we can get them sleeping better at night. So that baby needs to actually be unswaddled. Okay, they're still not waking up. We're going to change their diaper, rile them up for a feed, and you may have to kind of strip them down. Throughout a feed, you might have to blow on them. Or Jamie and I teach the chicken wing their arm, so you would actually bend it while they're eating. There you go. Or you can tickle their feet. And so, but we want to get them up. We want to wake them up for that feed. Our babies who have a fiery personality and go from 0 to 180, and you're like, hey, they're sleeping 1 minute, and then bam, they wake up and they're screaming, they're hungry, and you really don't get many of these cues. Obviously, we'll talk about swaddling and soothing coming up. You can calm them before you put them to the breast. But a great tip would be trying to catch your baby in an early on in a light sleep. And so babies, when they're sleeping, they will at one point be in a deep sleep. You'll know because they're very deeply sleeping. They're not doing any kind of movements. Where a light sleep, they're starting to wake up. So you see that they might start kind of moving in their sleep. But the biggest indicator is you can see the eyes moving under the eyelids. So for our frantic babies, that's a great time to just pick them up in that light sleep and then try to bring them to breast. So, anything to touch on that?
No, I think that was great. It is 0 to 60, not 0 to 180. The car reference.
Oh, whoops.
Yeah. It's a complete 180 if you're referring to something else.
Exactly.
0 to 60. And welcome to Boston.
That would be something I would do is slip something out like that. All right. So now we figured out that you're going to, feed your baby. So how do you know they're getting enough?
Yeah. Do you want me to talk about it?
Sure.
Sure.
Biggest question.
Yeah. So we get this question a lot, and breastfeeding can be really frustrating because you don't have a measurement on your breast to be able to say, oh, look, my baby got 3 ounces at that feeding. So we see a lot of moms, again, those first few weeks home because it can be really frustrating, or maybe your baby isn't gaining weight quickly or isn't gaining enough weight. Or you just want to know how much they're getting because that's really helpful to know. And so a lot of the education that we do during our lactation visits is not only doing a pre and post feed weight for our clients so they can actually know how much their baby is getting, but then also saying, look at your baby, look at what your baby's doing. This is how you can know that your baby's getting enough. So one of the major things that we talk to clients about in terms of breastfeeding and lactation is ensuring that you have a good latch, because that's going to increase milk transfer. And so that's always going to make your baby feel more satisfied. But when you have a good latch, one of the things that you can see and hear is swallowing. And for most babies, it actually sounds like they're pushing out a puff of air, and that's actually because they're sucking, swallowing, and breathing in coordination. So babies have to suck, swallow, and breathe in coordination in order to transfer milk. And so they actually are like pushing out a puff of air when they swallow. And babies aren't swallowing nothing, they're swallowing milk. So if you hear your baby swallowing, then that's a good thing. So right off the bat, we love telling families, like, this is the sound that your baby makes. This is what it sounds like when they're swallowing. They're swallowing because they're getting breast milk. So that's a huge indicator in terms of whether or not your baby's actually transferring milk. Babies should be swallowing, once your milk has come in, your supply has been established, baby seems to be breastfeeding well. Babies should be swallowing about every time they suck or every other time they suck. Sometimes with a lower supply or babies who are having issue with milk transfer, you may find that their sucking to swallowing ratio is larger than that. So that's also something to keep an eye on if you are experiencing issues with milk transfer or low supply. But swallowing is the number one indicator, and we love being able to tell families what swallowing sounds like and how to look for it. The other thing is just observing your baby. So prior to a feeding, like Emily was just talking about, in terms of their feeding cues, they usually start to tense up a little bit. Arms are up by their sides or maybe around the breast when they're feeding. Maybe their legs are kicking around. So they're actually they're more active. They're giving more active cues. As babies transfer milk during a breastfeeding session or bottle feeding, what you'll find is that their tone actually changes. So they're getting that feeling of satiation, and they're starting to relax. So their arms start to relax down to the side. Maybe they're falling asleep with the breast. Yeah. Their fists are opening up. These are all signs that your baby's getting enough food. So looking at those physical cues are huge as well. Is your baby, are they falling asleep at the breast and you can easily pull them away, or are they taking themselves off the breast? And when they do they have that food coma look that we all have at Thanksgiving? Are they passed out with that, funny smile on their face and their mouth wide open and eyes closed? That's what you're looking for in terms of this baby is satisfied. So that's a physical cues that you can sort of look for that your baby's getting enough to eat, in addition to listening for swallows. And then finally, wet diapers. Wet diapers is a huge indication of transfer of breast milk and hydration. After the first, so typically the recommendation in terms of wet diapers is 1 wet diaper per day. So if you have a 1-day-old baby, we're just expecting 1 wet diaper. 2-day-old baby, 2 wet diapers. By the time they're 2 weeks old, we want babies to have about 8 wet diapers a day. It usually ends up being 1 wet diaper per feeding, so it could really be anywhere between 8 and 12 diapers a day, but about 8 wet diapers a day. So those are a few things that you can sort of look for in terms of physical aspects. How do your breasts feel? So your milk has come in, you have that feeling of fullness or engorgement, and then your baby feeds and your breasts actually start to feel a little bit softer. That's a great indication that your baby is emptying your breast or partially emptying your breast. It's truly that feeling of fullness and then the feeling of softness. So your breast wouldn't feel soft if your baby wasn't transferring any milk. So another great physical indicator. And then watching weight gain. So this is something that your, pediatrician or again, lactation specialist can and will do. But they'll track babies' weight gain. And we touched on this earlier that the expectations for babies to regain their birth weight by 2 weeks of age, and then gain about 3/4 of an ounce to an ounce a day from that point on. And so you're going to the pediatrician frequently, at least, within the first few days home from the hospital, at least at 2 weeks of age, at least at 1 month, 2 months, usually 4 months. And maybe sometimes more frequently if you are having issues with feedings, weight gain, anything like that. So that's something that your healthcare provider will track pretty closely for you and be able to give you guidance in terms of what you should be doing for feedings.
I think what's really cool is when Jamie or I go into the home to do a lactation visit, we actually weigh the baby and then we have the baby breastfeed and we weigh them again. And that's also kind of fun way to see how much your baby is eating. You can actually see on the scale. It's
usually very gratifying.
Yeah, it's very gratifying that your baby took 2 ounces that feed. So sometimes moms are paying attention to all of these cues and they're like, I feel like am on point with these items. And then we do that weight and they're like, yes, okay, great. Baby's getting more than I thought.
Yeah.
So.
The other thing that I would mention too is, one of the hardest parts about being a mom and having a baby, especially your first baby, is you do sort of want like black and white answers and hard numbers, and we don't give a lot of those. But one thing that I do tell parents is the ounce and a half, the 3/4 of an ounce to an ounce a day is a marker that healthcare providers look for. So that is, what they're looking for. I repeat, do not go out and buy a scale and weigh your baby every day, because babies, even though we want babies to gain weight, 3/4 of an ounce to an ounce a day, they don't gain it that uniformly. So it's actually better to be weighing babies over longer periods of time than every day. Like, think about as an adult losing weight, right? Maybe one week you lose 5 pounds, the next week you lose a half a pound, and that's super frustrating. The same thing would happen if you were weighing your baby every day. You would get really frustrated with not knowing, how, if they're not gaining the weight like we're telling you they should. So leave the weights up to the healthcare professionals, just because we are trying to look at the big picture and not the day-to-day. And then the other thing that I like to tell families is, from when babies are born, like especially starting from 2 weeks and after, until babies are 5 months old, they're consuming the same number of total calories a day. So it's not like your baby as a 1-month-old and your baby as a 5-month-old are consuming different calories. Your baby as a 1-month-old is taking in, for example, 24 ounces a day, and your baby as a 5-month-old is taking in 24 ounces a day. It doesn't change. Yes, it wavers like day to day, a few ounces, give or take, but in general, they're taking in the same volume in a 24-hour period. So I feel like that's really important, especially for your moms who are going back to work. You don't have to increase your production by 3-fold to be able to sustain your baby's needs.
They just take it differently.
Yeah. And then the other piece of it too is babies, in terms of numbers, people are like, well, how do I know how much my baby should be getting or what I should give them in a bottle? Again, sort of once breastfeeding has been established, once your baby sort of regained their birth weight, the rule of thumb is about 1 to 1.5 ounces per hour. So that means, on the lower end, about 24 ounces, on the higher end, about 36. Most babies fall somewhere within that range. So for example, if your baby has gone 3 hours without eating, then on the low end, I would expect your baby to take somewhere around 3 ounces, and on the high end, maybe 4.5, if that makes sense. So I like to use the 24 ounces in 24 hours as a good example, because it's an easy 1-to-1 ratio. So again, as a newborn, maybe your baby is eating every 2 hours around the clock, and your baby's getting about 2 ounces at each feeding for a total of 24 ounces. As a 5-month-old, maybe your baby's only eating 6 times a day. So maybe they're getting 5 feedings during the day and 1 feeding overnight. And in those 6 feedings, they're taking 4 ounces for a total of 24 ounces. So what happens is your babies actually consolidate feedings, space out their feedings, and take more at each feeding. So I just like to give, where I can give, black and white answers and hard numbers, I do like to be able to do that, because I know that can be really helpful.
Okay, so we've talked about how to know when your baby's hungry, feeding them often and on demand, and then what do we do for our baby who's now overtired or overstimulated, or maybe they're just crying. And in the beginning, I remember I said to you guys, a lot of this is just troubleshooting. And sometimes you'll get tripped up, well, are they hungry again? And put them back to breast, and maybe they're actually just tired. So why is your baby crying? Why are they fussing? So we've established maybe that they're not hungry anymore. You've just fed them. Checking to see if it's a wet or dirty diaper. And then kind of moving forward past that, okay, are they overtired? And so in the beginning, we said we want you to feed your baby and not let them get overtired. And so, or maybe they've become overstimulated. So maybe the environment is too noisy. Maybe it's the evening and your husband just got home and you guys are cooking dinner and the news is on and you're talking about the day, and all of a sudden the baby is fussing and it's too much stimulation. Sometimes your baby could be too hot or too cold. And so as far as temperature goes, your baby should never be sweating and your baby should not feel cool. And so you're always going to kind of feel them up here on their neck. Hands and feet will be a great indication of temperature because they have central circulation. So the blood flow is not great to the hands and the feet. So they may always feel a little bit cool.
Chest and belly.
But chest and belly is a great way to feel. And so you can say, okay, maybe you're a little too warm, maybe you're a little too cold. Sometimes they're just gassy. And if you can imagine, we talked about that immature system in the beginning, and so part of that too is their digestion is immature, and so they the flap of the stomach is not sealed or kind of closed until 3 months. So, you may see some spitting up or feeling a little bit gassy after feeds. So we'll, have you be burping them and keeping them up right after feeds, but they might just have a little gas bubble and they're uncomfortable. Or sometimes then we realize maybe they're not feeling well. And so while that is usually not the common scenario with a newborn in the first few months home, if you really did troubleshoot everything and you felt like something really is off, you would check a temperature. And so a temperature in a newborn is not normal, and you would need to call your pediatrician, and the marker is 100.4 or greater. So you could check an axillary temperature under their arm or a rectal temperature and let your pediatrician know. But let's, for this sake, kind of go back and say we fed our baby, they were awake for a little bit, and now they're just overtired or overstimulated. What are we going to do? How are we going to respond?
Do you just want to talk about timing of like how long babies could or should be awake?
Oh, throw that in real quick, and then I'll go through that.
Yeah. So as a newborn, I mean, most newborns are really sort of getting to the cycle of like eat, sleep, eat, sleep. But I mean, they really are sleeping, about 18 hours a day, 18 to 20 hours a day. Right. And so for the most part, like babies as a newborn, their wakeful period of time is really the time that they're awake and eating. You may get maybe like 15 or 20 minutes, before or after feeding where they're awake and happy. In most cases, newborns, those first 0 to 4 weeks, 0 to 6 weeks, really can only be awake for about 45 minutes max. Sometimes feedings and all that are taking a little bit longer, so maybe 60 minutes. As your baby gets older, getting closer to 2-3 months, maybe your baby really can be awake for about 60 minutes or 90 minutes. As 4 or 5 month old, maybe more like 2 hours. But in most cases, prior to 5 or 6 months of age, babies really, especially for like the first 3/4 or half of the day, babies really should be going back to sleep at about the 2-hour mark. That really is, for those first few months, like that really is the marker of like trying to get your baby to sleep around that 2-hour mark so that they're not getting overtired, overstimulated.
I want to flip to the next slide for me really quick. So I want to go back to the beginning when we talked about open with the happiest baby on the block and triggering that calming reflex, because the biggest thing that I notice our moms saying to us is with their newborn, and especially in the first 6 weeks, is, oh, the baby's falling asleep nursing, or I have to rock the baby to sleep. And I want to really let you guys know that you're not making or breaking any bad habits in the beginning with your newborn. Your job is to feed them and not let them get overtired, and it is okay if you rock them to sleep. It's okay if they nurse and fall asleep. Mm-hmm. We can talk about as they get bigger how that flip switches. But in the beginning, we are going to treat it as the 4th trimester, and we're going to recreate that womb for them, and we're going to do that when they become overtired. So to trigger their calming reflex or calm an overstimulated and overtired baby down, we're going to utilize the 5 S's, which again come from the happiest baby on the block and the practice of Dr. Harvey Carr. And so we're actually going to demonstrate them, but really quick before we demonstrate, I'll just talk them through. So the first one is swaddling your baby. We know that it's time for them to sleep. We know that they're overstimulated. We want to give them that confinement and that comfort of what they had felt in your belly. And so we're going to use swaddling to do that. Part of triggering the calming reflex is actually getting the baby on their side or their stomach. So safe sleep, when you put your baby down to sleep alone, you will always put them down swaddled on their back to sleep. So you can remember it easily, back to sleep. But when you're holding them or soothing them, your best position to actually calm them down in and trigger the calming reflexes on their side or their stomach. Then we can implement swinging, which mimics that motion, that movement that they had in womb, as well as shushing, which mimics the white noise that was going on inside of your belly. Finally, our last S is sucking, and so perhaps that's a baby who needed to breastfeed and needed to regroup, so you can go ahead and breastfeed them, or you can offer a pacifier. Or your finger, yeah. Sucking is such a normal newborn behavior, and it's a way for them to self-soothe. And so once your milk is in and breastfeeding is well established, which can be very different for moms, that could be a couple days in, a week or 2 out, we are very comfortable with parents using pacifiers, and the American Academy of Pediatrics actually recommends pacifiers as well. So, but let's put it all together. So we have our swaddling, getting our baby on their side or their stomach, swinging, shushing, sucking. You can do some of these, or you may need to do all of them in motion. And so we're actually going to kind of attempt to show you this here, and then we'll be uploading a video of Jamie doing it with a live baby later this afternoon to YouTube, so you can also watch it with a live baby. So,
one thing that I like to mention to parents too is the shushing. I feel like as moms, we take our babies and we always do like the light, like shh, 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 shh. But babies actually really like loud, deep tones because that is what they are used to inside the womb. And so spouses are usually really good at the shushing. It's a deeper tone, it's a louder tone, and you're actually going to match the volume of the shushing to the volume of the baby's cry. So it's a loud, deep shush, and Emily will show you how to do it.
I mean, before we had white noise machines, our parents, I mean, my mom plugged a vacuum cleaner in.
Hairdryer?
Yeah, hairdryer, and just let it run. And now we have these like awesome sound machines by like Marpac and other things like that. So I'm going to do my best to kind of show you this here. If I stand, you guys can still see me. So you can take any blanket to swaddle. So these are traditional blankets from a hospital. You'll see that blankets now, you know, you've got beautiful Aiden and Anonymous ones. You can get Halo sleep sacks or other devices that have Velcro in them, which can make swaddling easier for parents. The bottom line is you can swaddle your baby with any blanket. I think that, you know, you'll get a bunch for maybe presents and things like that at a baby shower, but you should pick one that you feel like you can do the best swaddle with on your real live baby once they're here. Whatever is going to help you to get it tight and to help it stay. This will be a lot of trial and error. If you're taking a regular blanket that doesn't have Velcro or doesn't come as a swaddle for you, you would actually fold it down like a diamond. And so I'm going to flip it on the table here. And so now I have it, so the top part is straight here and it's coming into a diamond like this. You would take your baby and you would actually kind of tuck their hands in, because we actually want to keep their hands inside the swaddle, because if they're out, they're going to be like this, and then they're going to break out of their swaddle and it won't work. And you're going to come across their body. The key is to make it really tight. And you'll learn the first couple times you do it with your baby that if you didn't make it tight enough, they'll get out of it and you'll have to do it again. That's why Velcro is really helpful, because it just sticks when you pull over. So you're going to come across their body. You can then come down to the bottom here and take this bottom fabric and pull it up. And that can be light. It doesn't have to be really tight. Babies actually like to kick their legs inside of sacks and swaddles, and that helps with gas. But I really want that upper body nice and snug. And then our final one, we're going to come over again the shoulder, and we're going to take this last piece and pull over. So we've actually kind of created like a baby, can you guys see a baby burrito here? So we've got the baby swaddled, probably still fussing or crying. So now I'm going to get them on their side or their stomach. How do we do that? So typically when we hold a baby, we're like, oh, hello, baby, and we're looking at them, but they're actually on their back. They're uncomfortable. So in the same arm, you're really just going to turn them, and you can hold them on their side facing out, or you can turn them even more in your arms so they're actually facing down to the ground, and now they're on their stomach or their side. And so I find this easy because they're tucked right in my elbow here, so the head and the neck are supported, and this hand's not committed, okay? I can still do something else with it. Most babies that we cross paths with who are fussing will typically stop at this point. But if they're really worked up, there's probably still crying at this point, and that's when you're gonna start swinging. Okay, and the head and the neck are nice and stabilized. You also can put your hand right here and swing like this, and it's a pretty quick movement actually. You also could bounce a little bit too. Whatever feels more comfortable. Then, as Jamie said, we're shushing and we're matching how loud they're screaming with our shush. And the nice piece about them being right here in your arm is that you can be right in the ear. Shh. And as the baby quiets down, you would then lower the volume of your shush. And then your fifth S is sucking. So at that point, you could breastfeed, you could give the baby your finger, or you could hold a pacifier in right here and continue your motion of that swinging and shushing. And then finally, your baby will calm down and will fall asleep. And then you should be able to put them down on their back. Still swaddled is fine. You can have them swaddled while they're sleeping. And you are welcome to give them a pacifier if you're using one when they're going down for that period of sleep, but they're on their back for sleep. Anything to add to that?
No, I don't think so. That was good.
And so like I said, we have a nice video of Jamie doing it with a real baby, and we'll be putting that up on our Boston Naps YouTube channel this afternoon, so you can actually watch it of a baby who's, you know, maybe crying. I think he was pretty good for the video.
I know. I think we had just given him a bath too, and he's still pretty good.
Still was a good baby. All right. So I think at that point,
I would just
do you want to wrap up with anything?
I was just going to quickly touch on
this.
the 6 to 12 weeks because I know that that going back to work can sometimes be a stressor for those of you who are going back to work, and sort of what those second 6 weeks look like. So 6 to 12 weeks, so we were talking about survival mode, 0 to 6 weeks. 6 to 12 weeks is when you can start thinking about a routine and a little bit more of a schedule. One thing that I will tell you is that daytime sleep is always just going to be a little tricky. We really do tell our clients not to stress too much about daytime sleep, like it happening at the same time every day, how long it's happening for, like getting your baby on a good like set napping routine. That can be really challenging, and it usually actually goes hand in hand with better nighttime sleep. So we do like to tell parents to focus more on nighttime sleep than daytime sleep. The one thing that I will tell you with daytime sleep is that 45 minutes is a sleep cycle. So if you can just get your baby to take 45-minute naps throughout the day, that's a sleep cycle that should make your baby feel refreshed and be able to get to the next, get through the next feeding and, be happily awake and hopefully get, another 45-minute nap in. So I do just like to give people that marker for the daytime sleep. But in terms of falling into a little bit more of a routine during the second 6 weeks, I like to talk to families about just establishing a bedtime and a bedtime routine. I feel like that's really important. What you'll find is that your baby will start to get fussy around the same time of night. So when we were talking about this first 6 weeks, maybe like your nighttime hours are, really did start at like 10 or 11 p.m. So now we're trying to bump that up a little bit. Your baby's probably going to have a fussy period. Everybody refers to it as the witching hours. Usually sometime between like 6 and 9 p.m. So pay attention to your baby's cues. Are they getting fussy around the same time each night? Is it, it might be within the same hour or 2 hours, their bedtime will likely be in that time, during that time frame. So you can start thinking about establishing a bedtime, having a set bedtime, and it really, so if you're choosing 7 p.m. as your bedtime, your baby really should be asleep or you should start your bedtime routine within 30 minutes on either end of whatever you establish as your bedtime. So being consistent with that. And then establishing a bedtime routine with your spouse or partner. And what does a bedtime routine look like? 3 or 4 of the same steps every night, nothing crazy, something that's easily replicable by anyone. So it can't be, we were just joking, it can't be a song that only you and your husband know in another language, right? Like it has to be Twinkle Twinkle Little Star, or it has to be something universal. But your 3 or 4 steps will be, and it doesn't have to be a bath every night either. We've established that, I don't take a shower every day, so neither do my kids take a bath every night. So that's not part of my bedtime routine. Never has been. But it can be. But typically
I have to bathe my kids every night because they're literally filthy because they get into everything.
But it can just be PJs on, read a book, sing a song, baby in the swaddle, feeding, white noise machine on, love you, good night. And put them in their crib or bassinet or sleeping place, safe sleeping place. But really, it's just the same, same 3 or 4 steps that you can do anywhere. So if you travel, you can do it anywhere. And that anyone else can do. So if you have a babysitter come in or a family member watching your baby or whatever the case may be, they know the 3 or 4 steps and they can easily replicate them as well. So that's one thing that we talk about with families. And then the other piece is, before where I was telling you, establishing days and nights, by 6-8 weeks, I would expect your baby to have days and nights established. And so that, between 6 and 12 weeks is really when you can start to space out feedings a little bit during the day. So if you do have a baby who really is still eating like every 2 or 2.5 hours during the day, that can still be very normal. So you don't have to change that. But if you did want to space out the feedings a little bit during the day, you can. And babies really can go, maybe more like 3 or 4 hours in between feeds between 6 and 12 weeks instead of, having to wake them up at 3 hours. So if they are still sleeping at the 3-hour mark, you really can push it to 4 hours, knowing that they're consolidating their feedings and they're taking a little bit more in each of those feedings. And then in terms of, sleep, nighttime sleep and how that sort of starts to change. Typically what ends up happening is babies will wake up, so let's use 7 p.m. Bedtime as an example and a 7 a.m. wake up time for the day. Typically when babies are waking up to feed, they wake up about 3 times a night. So it might be 10 p.m., 2 a.m., 5 a.m. When babies start to drop feedings overnight, they typically drop the first feeding of the night first, so the 10 p.m. feeding, the third feeding of the night second, so the 5 a.m. feeding, And unfortunately, the middle feeding of the the middle of the night feeding last. And I know that's the one that we probably all hope that they would drop first. But that is typically how babies drop feedings. And so I feel like just knowing that information, and again, once your baby has sort of dropped a feeding, they really have dropped, in most cases, they really have dropped that feeding, and you can sort of rest assured knowing that they'll continue along that same sleep pattern. But that's typically what you start to see happen, and every baby's timeline is a little bit different, but in terms of general guidelines, that's typically what I like to talk to people about between those 6 and 12 weeks, and sort of establishing a routine, daytime routine, bedtime routine, what to expect overnight. Anything else?
No, I think that's perfect. Okay. Yeah, people want to know when will my baby sleep through the night. And if they're not sleeping through the night, when they're past 6 months, you can call us. And so now we actually have someone here from Cozykin who's going to help us. I know many of you probably have questions, so we're going to have some time now to take some questions that come in, and they'll let us know what they are, and we'll be happy to answer them. And as we're queuing up people sending their messages in right now, I did want to point out 2 resources that are free through Boston Naps for questions if you don't get a chance to answer your question, for us to answer your question today. And so our first one is on Instagram. So our handle is Boston Naps. And every Monday we do something called Moment for Mom. And it goes on from 8:30 to 9:30 p.m. where we put up a post, and you're allowed to write in any question, whether it's about pregnancy or your baby. And Jamie or I will answer it in that hour. And then the second resource is on Facebook. We have a Boston Naps community group that you have to ask to join. It's for moms who have utilized our services or are interested in them in the Boston area. And that's another great platform to write in questions about your pregnancy or your baby or things like that to get some answers. So with that, I will say check in and see if we have any questions coming through.
Checking. Just let everybody know that they can type in the chat.
Oh, you can, yeah. So,
here?
yeah. We were just being told that if you guys didn't already know, you can actually click on the chat and type in any questions that you have, and we'd be happy to answer them live for you. Emily was also mentioning some of our other resources. We do offer, if you go onto our website, for those of you who are in the Boston area, we also have a bunch of free support groups. They're called breastfeeding support groups, but we welcome all moms. Breastfeeding, really bottle feeding,
support group.
Yeah, formula feeding, pumping, and bottle feeding. It doesn't matter. It's just a support group. We just want to be able to give people resources. So you can look up where we're hosting those groups each week.
Okay, so we have our first question, which would be, what resources do you have or ideas to relieve baby gas?
I'll take this one.
Sure.
This comes up a lot. So if you're talking about just like normal newborn gas or even normal reflux, so all newborns have reflux, right? It's just a matter of whether or not it's reflux that's causing an issue or just normal reflux. So just first talking with your pediatrician or your healthcare provider about that. But we're just establishing that your baby has gas or some reflux issues. What can you do to help with that? So the first thing that we tell families is actually do tummy time before feeds. Tummy time before feeds is really helpful for babies who are gassy because it actually puts pressure on the belly and pushes any air that's in the baby's stomach up towards the top of the stomach. Why is that helpful? It either makes it easier for that baby to get that air out in the form of a burp after feeding, or it just doesn't sit in the bottom of their stomach where it actually causes a lot of pain. So tummy time before feeds is great. It's also, developmentally helpful because you're actually getting some tummy time. That could be for 30 seconds. That could be for 5 minutes. It's really whatever you feel like your baby can tolerate. So tummy time before feeds is great. Leg exercises at every diaper change is what I recommend to families as well. So what are leg exercises? There's usually 3 exercises that I tell parents to do. And you guys can see, right? Oh, yeah, that's fine. So, there you go. It's a bigger screen.
Oh, perfect. Okay.
So leg exercises are bicycle legs. So literally taking their knees and pushing them into the belly. Yeah. Taking both knees, pushing them into the belly and pulling them straight out. Pushing them in, pulling them straight out, and then circles. So leg exercises do 10 of each and do them at every diaper change during the day. That helps GI motility, so movement of gas, Anything, if they're having a difficult time having a bowel movement, that keeps things moving in their small and usually immature GI systems. And then the last thing that I tell people, if you're really having issues with gas or reflux, is keeping them upright for about 20 to 30 minutes after feeds. Think about if you were to eat a big meal, and right after you ate that meal, you were to lay flat on your back. As an adult, that seems like it would be really uncomfortable. It's the same thing for a baby. So sometimes just keeping them upright for 20 or 30 minutes and allowing their digestive system to actually break down some of the contents of what they've eaten can help make it easier for them to actually be placed in a more flat position. And then finally, Emily and I have recently come across a few research articles about probiotics for babies, and there's a brand called BioGaio. There's been a lot of research linked to giving babies probiotics and it helping relieving any gas issues. And also one of the studies that I read, I don't want to cite it because I'm not sure, but I believe it's out of a hospital in Cincinnati through a GI specialist there. But it actually decreased the total amount of crying time in the control group for the babies who were taking the probiotics. So it can also just help with babies who are just fussy in general as well. So probiotics is more recently something we've been recommending to our families.
We have access to that article if anyone's interested. And so
There's actually one that came in through the Q&A section. This one asks that, when do you start doing an earlier bedtime? My 11-week-old is still doing the 11 to 7 a.m. block as nighttime hours.
Okay, so the question is, and I'm not sure if you guys can hear it, but the question is related to doing an earlier bedtime. There's an 11-week-old who's doing the 11 p.m. to 7 a.m. Nighttime hours. So
still fourth trimester.
Yeah. So you're still within that 12-week period of time. It all depends on sort of what schedule works for you also. But if you were trying to move up your baby's bedtime, at 11 weeks, one of the strategies that you actually could try is just moving your baby's bedtime up by about 10 minutes every 3 to 4 nights until you get to the desired bedtime. It does depend sort of what's happening in the evening time. If you can actually get your baby down to sleep earlier, have a bigger jump and get your baby down to sleep earlier, say around 7 or 8 p.m., knowing that they'll still probably wake up at 11 and want to eat. But maybe that really is their first feeding of the night at that point. But if you're having a hard time actually like making that big jump to an earlier bedtime, then I would actually just recommend doing it in smaller increments where you're just doing it for, again, about pushing it up about 10 minutes about every 3 to 4 nights.
Let's see. We have one here that says, my son is 7 months old and he still is swaddled and won't sleep without it. What's the easiest way to get him out of the swaddle forever without causing him to have trouble sleeping? This is actually a great question because I had a feeling somebody was going to ask just in general, when do you stop swaddling? Yeah. So I feel like I can cite that into this. So we typically swaddle babies for the first 3 months of life. However, you'll have seen that there are multiple other swaddling devices or sacks or suits on the market. So you'll see that Halo Sleep Sack makes a similar swaddle, but now the arms are actually out. And Merlin makes like a magic sleep suit that you can zip into, so they're more free, less tight like this, but they're not going to startle. So around 3 months, you don't necessarily have to swaddle anymore, but it's also not wrong to be swaddling. Once your baby can roll over from their back to their belly completely on their own, we really want to be careful about what you're putting them in their crib in. Typically, you would just put them in their crib in just their pajamas at that point. However, considering this question here with a 7-month-old who's still swaddled, I'm okay with that as long as the arms are out. So a child can be in one of the Halo sacks with complete upper body and arms out and be able to still roll freely back and forth in the crib. So I think that that's fine. If you're finding that you're swaddling and kind of constraining them, my best advice to get out of the swaddle is to just cold turkey stop using it. Put the baby in the crib. They will figure it out. It might be up to 3 nights of kind of diciness of them learning how to fall asleep, but they will learn. And after 3 nights, they'll be fine and they'll sleep without their swaddle.
Yeah. With the swaddles, if your baby's rolling over in a swaddle or any other type of like suit or where their arms are sort of restricted, like the Merlin sleep suit, even, the recommendation on there, the recommendation even on their website is once they're rolling over in that, you really need to take them out of it. And it's the same thing. So it's the same recommendation for the swaddle. As a personal story, my daughter was in the Merlin sleep suit. until she was almost 8 months old because she never rolled over in it in a crib. And it finally got to the point where I was like, I actually just feel like I need to take her out of it. So I did, and it was about 2 days of like her figuring out how to put herself to sleep for naps and bedtime. But then once she did, she actually was sleeping even a little bit better than she was before. So it's always an adjustment period, but at 7 months, the best recommendation is either probably a sack with the arms out, or just cold turkey and just putting them in their crib with just their PJs on. Yeah.
Let's see here. There's a lot of questions coming through. If you are breastfeeding, how soon can you start feeding breast milk from a bottle so others can feed the baby rather than just mom? Great question. I like that one too. So we're pretty open here. We're liberal lactation consultants, I would say.
For sure.
And so everybody's path will be different. And so I've certainly had moms who are pumping and giving a bottle for dad in that first week home, and some moms who are starting it up 2 months out. And it's really going to be very individualized per family. However, again, if you're breastfeeding, once your milk is in and breastfeeding feels well established, meaning you understand when your baby's hungry, you feel like they take the breast well and they know how to drain it, and you recognize that they're hungry and now they're full. Again, that can be a couple days for some women or a couple weeks. We find that it's completely acceptable to go ahead and pump to give, your husband or a partner a bottle for you to sleep. I think a common scenario of what that might look like with families that we work with is perhaps they know that, mom's feeling really tired, so maybe that weekend she'd like to sleep a little bit so, somebody can give the baby a bottle. So we typically recommend that moms pump first thing in the morning because that's when you have the biggest and greatest milk supply. So you would feed the baby off for both breasts, and then you would go ahead and pump your breasts after both of them at the same time for about 10 to 15 minutes, and you would make some milk for a bottle. It might take you a couple days, like Wednesday, Thursday, and Friday morning to make enough milk for a bottle for like Friday or Saturday night. Or you might be blessed with a lot of milk and you might pump that just in one sitting. And so at that point, you would, feed your baby at 8 or 9 o'clock at night, Friday or Saturday night, hand the baby over to your partner with the bottle for the next feed and go to bed. And so that way you could buy yourself like a 4 or 5 hour stretch, and then your partner can give the bottle while you're sleeping. The best way to give a bottle to a breastfed baby is to pace them. So all bottles have a slow flow nipple on them, but we want to slow them down. They breastfeed in 10 to 15 minutes, so they should take their bottle in 10 to 15 minutes. Honestly, the best way to feed your baby slowly and pace them is to feed them on their side because they're breastfeeding on their side. So you can actually lay a baby on the couch or right there with you up against something or on a boppy pillow, and you would actually come in from the side and feed the baby the bottle side lying. And that's how you're going to pace them and slow them down. All right, let's see, keep going.
Yeah.
Is the probiotics recommendation for formula or breastfed babies or both?
Both.
Both.
Yeah, so the study was with both breastfed and bottle-fed babies. And there were, again, like in the control group, they had a certain number of time prior, they had timelines in terms of like how much babies were crying prior to the study and then after the study. But it did include both breastfed and bottle-fed babies. So probiotics are great for both. There actually are some formulas now that have probiotics in them.
Yep.
So that's even an option. If you have a formula-fed baby, you can even just look at some formulas, or you're planning on formula feeding your baby, you can look at formulas that already include a probiotic.
I think we have time for one more question. Does that sound about right?
Yep.
We have another one here. Is gripe water safe for relieving gas? Yes, most pediatricians are okay with that. They make like simethicone drops or gas drops over the counter. I'm not quite sure how well they work, so I would defer to your pediatrician to see if they're okay with you using them. From like my more mom personal experience, my first had reflux, so I tried everything, and I did try grape water or gas drops, and it was really hard for me to see if they made a difference.
Yeah.
I find that you notice for gas, honestly, your biggest marker for noticing a difference in relief is tummy time before a feed and keeping the baby up right after feeds and bicycling the legs as Jamie demonstrated. But yeah, anything to add to that?
Yeah, I mean, grape water is one of those things where, like, I wish that there was, more substantial research on it. It's sort of like taking, supplements with breastfeeding. But it is one of those things where you can certainly try it, and if you feel like it works, then great, keep using it. And if it doesn't work, then don't feel compelled that you have to keep using it. But there's certainly, I mean, as Emily mentioned, like run it by your pediatrician first, but there's usually no harm in just trying it and see if it provides you with any relief, or your baby with any relief.
These were great questions. Thank you, everybody, for chiming in. I think we got to most of them, and for those that we're out of time to do, I really invite you to join us on Mondays or on our Facebook platform. We're more than happy to answer you. Again, my name is Emily Silver from Boston Apps, and this is Jamie O'Day.
Thanks so much for joining us today, you guys.
Thank you for joining us, and thank you to our partners at Cozykin for providing the space for us to do this, this great webinar for you all. Have a good afternoon.
Have a good day.